So this patient is recovering from a chin implant, as well as some other facial surgery. But after a chin implant, there's always this incision. It usually measures about 25 to 30 millimeters. And we care for this in the same way we care for other incisions, which is you start by with a wet step, which is hydrogen peroxide. Just kind of gently placing a little hydrogen peroxide along the suture line. If there's blood present, then that's going to kind of fizz up, clear out all that debris. You're going to make sure it's dry, that there's no excess fluid there, and then place a little bit of ointment, a thin layer of ointment on those sutures to keep it moist. And you're going to be doing this twice a day while the sutures are in place.